Good morning and welcome to Georgia Surgicare. Today I have a young patient of mine who is interested in the Orbera balloon, specifically for weight loss. Here I have Mr. Jaime Pinzon. How are you doing today?
Dr. Chris, how are you?
My pleasure. Always a pleasure seeing
too.
you. I know you've been doing very well on your own with diet and exercise. And how many pounds have you lost so far?
So far, 15 pounds.
Very good.
15 pounds, but I'm in that place where you get stuck. So that's why I asked for the consultation with you, Dr. Chris, and I know you have a good option for me today.
Very good. So you're not alone. Most patients, all of us struggling with weight loss, will end up with something called a plateau phenomenon. It's complicated, but you can easily kind of like sum it up into a situation where your body actually thinks that you're losing too much weight or that you're starving, and it tends to hold on to every single calorie. It's a very natural phenomenon. We talked about ways to address the plateau phase, and you've been doing very well. You've taken some medications to help you with appetite control. You're exercising more, right? And you're
every single day.
Very good, very good. And you're also eating very, very nice. Well, at this phase, we have what we call non-surgical options that we can talk about. One of them is the intragastric balloons. Have you heard about them before?
Kind of, but I have questions like this will be for life or this will be just for a couple time, for time, I don't know.
Very good. So they are considered to be a time-limited option. The balloons usually are FDA approved to stay in the stomach for about 6 months. During these 6 months, most of our patients will experience an average weight loss of 50 pounds, which is quite significant. And if you sustain your behavior for the subsequent period of time, you're going to keep the weight off and even maybe lose some weight as well.
Nice.
Is that something that you might be interested in?
I'm 100% sure that this will help me just to lose all those pounds that I'm trying to lose, but I'm stuck with.
Very good. What is your goal? How many more pounds are you looking at losing?
Well, I started when we started the process here. I started with 245 pounds. Now I am in 234.
Very good.
But I really want to be between 160 to 170.
Very good, which is going to be a very ideal body weight for you. Yes, so obviously, let's talk about the different types of balloons that are available. In the US, there are 4 companies that produce FDA-approved balloons. One of them is the Orbera balloon, which is considered to be a balloon that's filled with liquid. Have you heard about the Orbera balloon before?
Yes, I think that's the most common one, right?
That is the most common one and one of the most effective one as well. It is a very, very straightforward balloon. It simulates having food in your stomach for a long period of time, thereby giving you a sense of fullness as well as a sense of lack of appetite. And subsequently, you will notice that the amount of food that you eat is small, and you're eating small portions at each meal, and you're able to stay full for a long period of time. The average weight loss with this balloon in our practice is about 50 pounds, and we've had people lose 90 pounds on the balloon alone.
That's perfect.
Yeah. So the Orbera balloon is an adjunct to a very successful weight loss patient like yourself who's well educated on behavior, eating habits, exercise regimen, and so on and so forth. Do you have any questions about how the balloon is done?
Yeah, actually, you said that this is not a surgical procedure. How this balloon works?
Very good. So it's not a surgical procedure because it does not involve making incisions in the body and putting anything there. What we actually do is we bring you into the endoscopy suite. We will get an IV started and we'll give you some medication to help you relax. Once you're fully relaxed, we will put a lighted scope, called an endoscope, through the mouth into the stomach, examine the stomach and make sure there's nothing going on that may make us change our mind. And once this is done, we will then pass the balloon down into the stomach through the mouth, almost like swallowing food down into the stomach. Once the balloon is in your stomach, we will fill it up with fluid, and the entire process takes about 15 minutes. Once this is done, we will take the lighted scope out, leave the balloon in your stomach, and we will take you to the recovery room where over the next 20 minutes you'll wake up and be ready to go home.
Okay, so I can go back to work just as fast as the next day or the same day?
Yes,
okay.
The downtime is very, very, very short. It's about 12 to 24 hours. So most of our patients go back to work the next day, and which is why this balloon is very appealing to active professionals and young professionals like yourself who don't have time to recover from a major operation from the balloon.
I have another question. What are those side effects as soon as when you get the balloon? Is there like you feel dizzy or?
Well, the most common side effect that we experience with the balloon is nausea and vomiting. And we do have a program here where if you experience significant nausea and vomiting that is not controlled by the medication we'll give you, we will bring you back and we'll rehydrate you. We have a hydration system where we'll actually have the nurses get you some IV fluid and get you taken care of, so you don't have to go to the ER and waste time or money. Other things to worry about is the diet. So we don't want you going out to go eat regular food. We want you to stay on a liquid diet for a week and slowly progress to soft food and then regular food. We also worry about ulcer formation, so we prescribe you an anti-ulcer medication for a period of 6 months. When the balloon is in your stomach, you have to take an anti-acid medication for the entire period of time. We've placed this balloon in patients as young as 18 years and as old as 80 years, and it's considered to be a very safe procedure.
It is any restriction, since I had glaucoma, is any restriction?
No, there's no restrictions. The activities that we worry about with a balloon are any activity that will involve significant changes in the barometric pressure, such as if you're high altitude pilot who stays in high altitude for a long period of time, or you're an alpinist who climbs mountains, or if you're a scuba diver who descends to like very low heights. We strongly recommend not proceeding with the balloon. Okay,
perfect. And when we can have the balloon?
Well, I'll check my schedule. We usually get it done any day between Monday and Friday, usually in the morning between 8 and 12 noon. And like I said, it's overall it's about 1 hour stay, 5 minutes to prepare, 20 minutes for the procedure, and 30 minutes to recover, and you should be home within an hour.
Okay, so I will set up the appointment. Thank you so much, Dr. Chris, for helping me in this journey to lose weight, to make me feel better with myself and my family. And I appreciate it. Thank you so much, Dr. Chris.
Well, I mean, it's a true pleasure taking care of you. It has been from the beginning. And I look forward to taking care of you during the balloon phase as well as afterwards. As you know, weight loss is a lifelong journey. Thank you.
Yes, sir. Thank you.
Yeah.